You're watching the Isaiah Factor, Uncensored.
And welcome back to the second half of the Factor Uncensored. Like it or not, the pandemic is here to stay, and COVID is a very real disease. Both COVID cases and hospitalizations are spiking around the country, and infection numbers may be much higher than we realize. Dr. Danish Ali joins us with an important reminder: do not let your guard down.
Dr. Ali, it doesn't matter where I look around me or the people I know, friends, family members. A lot of people are turning up positive for COVID right now, but we don't see it reflected in the national news. And is this something you're seeing? And if so, why don't we see these numbers reflected nationwide?
That's correct, Isaiah. Well, what we've started to notice is that these numbers are increasing, especially in the last 24 to 48 hours. Our average numbers of cases have been around 1,500 for the past couple of months. However, yesterday's data showed 3,500 folks that were infected with COVID. And Isaiah, mind you, that includes those folks that actually got PCR tested somewhere and were confirmed positive, and then those results were sent off. There are so many of those folks, so many patients, so many people who may have COVID. They got their rapid test done from home or from their pharmacies, and now their isolation and those cases are not reflected in that. So I do anticipate, and I agree with you, that we have seen an increase significantly within the last 48 hours in the number of cases that we're seeing in Harris County.
Now, that number that you gave us, 1,500 and 3,500, that's for Harris County, Houston, what?
Harris County, that's correct, Isaiah. If you Google the number of statistics as we speak currently, we're about 3,500 for yesterday, number of confirmed cases of COVID. Prior to that, the average has been around 1,400 to 1,500 that we've been at. So it is a significant increase that we're seeing recently.
And of course, obviously, the federal government sent out free tests, and I think they're on their second round of free tests. And as a result of people taking these tests at home, it gives us a false sense of security of actually what the numbers are. As you said, they could be much higher, but people are taking their test at home, and it's their personal business now. What is prompting the rise in cases?
I think we've kind of let down on some of our safety measures that we had in place, Isaiah. I think that lots of folks have forgotten the mask. We've forgotten that we need to get reboostered. A lot of folks I've talked to who have tested positive were like, well, we just didn't get the booster, and they may have gotten the initial vaccine. A lot of these, and thankfully what we're seeing is that we're not seeing that significant increase in hospitalizations as of yet. I know that the data lags a little bit, and folks who get infected take a few days for them to actually end up in the hospital, and for those numbers for us to be evident of those data. But having said that, though folks are vaccinated and some of them are boosted, their symptoms are mild, and some of them are even asymptomatic.
And so what advice would you have for people? Obviously, now we're starting to travel more. We're getting back on the airlines. The airlines have eliminated or made it optional to wear a face covering. So what would you advise people to do to stay from contracting COVID-19 or being positive with this?
Isaiah, the easiest thing to do is put your mask on. That's number one, right? That goes without saying. We were able to get through this pandemic before with this mask. Let's put this mask back on. Look at your vaccination status, see if you've been recently boosted and received your booster shot, and see if it's appropriate in terms of its duration. And if you need to go back in and get your vaccine and get your booster, do that. And again, practice safe hygiene, wash your hands, bring that hand sanitizer bottle back with you, and be careful with who you're interacting with, especially folks who have not been vaccinated, and keep that mask on.
And the door has opened up for children too in your home, right?
That's correct. Yes, now children are able to be vaccinated as well. It's important to call your local pharmacy and ask them if they're doing vaccinations for children. I know that Texas Children's is doing it, and a lot of the local pharmacies are also providing those vaccines. And so very important to call your pharmacy, make your appointment, and either get your first shot if you haven't, if you're a child, or get boosted if you are in that window now.
All right, I think we just let our guard down. Dr. Danish Ali, Arch Point Pain Institute, thank you for joining us tonight here on The Factor Uncensored.
Make sure you be careful out there.